Here is your stem.
Okay.
All right, both are ready?
Yes.
But ma'am, the details.
You can use from your traditional notes.
Okay, I'll just make up next. Okay.
Okay. I will open the notes. Just 1 minute.
Sure.
Okay.
Now both are ready?
Yes.
Okay. Yes.
All right, so please start. Begin.
Okay. Hello, I'm Dr. Ala Abdullah. I'm the CT1. Yes, I'm CT1 doctor, surgical doctor in Royal College Hospital working under Mr. Mac. I'm calling the ITU registrar regarding a patient regarding a critical patient who's admitted with perforated viscous and is undergoing laparotomy. I want to ask him for advice regarding his treatment and the rate for post-operative HDU bed. Could I confirm that I'm speaking to the ITU registrar?
Yes, the ITU registrar with you. Can you summarize your case?
Okay, yes. So Miss Lisa, a 76-year-old female, who's known case of COPD and taking steroid, presented with sudden onset abdominal pain, and after workup, she is to have perforated viscous, and she is undergoing urgent laparotomy. Miss Lisa presented with sudden abdominal pain and vomiting, and now on examination, we found there is a tenderness over the left iliac fossa, there is a garden, and there is rigidity. And Miss Lisa, she says she's 15, but she's tachycardic and hypotensive at the moment. We did blood investigations, including ABGs that showed metabolic acidosis, and there is high inflammatory markers, including leukocytosis on the CBC, and there is raised CRP as well. So her other investigation were normal, beside other than elevated renal function tests, including high creatinine and high potassium. So we are suspecting that Ms. Lisa is going into acute renal failure due to sepsis, and she will need post-operative HDU admission. And I also need an advice about her management at the moment. Yes.
What made you think that it's a case of perforated viscous?
Yes, the sign and symptoms Ms. Lisa presented with, she has localized tenderness and rigidity, which is a sign of peritonitis. Yes, and we also did an X-ray, which showed the absent solar shadow. There is also fluid collection on ultrasound, and we arranged for a CT scan. Yes.
What fluid resuscitation will you do?
Yes, in this case, I will start by giving the certain white bore IV cannula and giving Ms. Lisa 1 to 2 liter of crystalloid fluid. Yes, in
Yeah.
the form of ringer lactate or hormones.
Okay. You will give her crystalloids only?
Yes, I will check for electrolyte disturbance and I will add supplements.
Okay.
Yes.
What preoperative arrangement do you suspect?
Yes, as Ms. Lisa has COPD and she's taking steroid, I will inform the consultant and inform the anesthesia, and will also arrange for post-operative HDU admission and for prophylactic need for mechanical ventilation or non-invasive ventilation. Ms. Lisa, I need to be our oxygen level should be monitored and should do X-ray to exclude any infections in her chest. as well, and I will use a replacement therapy for steroid, including 200 and 100 IV cortisone during the surgery and 200 milligram in the first 24 hours of IV hydrocortisone. Yes, and after the operation, I will give Miss Lisa analgesia to help her with breathing and will encourage early mobilization. Yes.
Okay. So what about criteria for ITU admission?
Yes, for ITU admission, the patient should either need mechanical respiratory support or need support to one failed organ plus the existence of severe chronic organ failure, or he needs support for two organ failure. Yes, or need one-to-one nurse patient care.
What if I only have one ITU bed left and there is an asthmatic young lady coming first?
Okay, so in this case, I will try as much as possible to keep the patient in the resuscitation room after the procedure, and I will discuss with the bed manager to find solution for repartition or early discharge for the patient in the HDU. But I should also mention the importance that this patient needs admission because he's critical patient and I need invasive monitoring after the operation.
Okay.
Okay,
Can you
thank
please,
you.
thank you. Can you please tell me, since your patient is known case of COPD and has been taking steroids, how would
Yes.
you make the surgery, the urgent laparotomy that you want to go ahead with? How would you optimize this surgery? What measures would you take or keep in your mind?
Okay, as this is an urgent surgery, I cannot check the patient smoking status, but I can do urgent X-ray to exclude infection and start treatment if there is infection. I will, in this case, I have to use general anesthesia, but I will try to make the surgery shorter. And
With regard to COPD?
yes, COPD.
Yes. How much oxygen would you give?
Yes.
Saturation threshold would be kept at what level?
Yes, the saturation should be kept between 88 to 92%. Yes.
Lower. Okay. And since patient was taking steroids, you don't have an account of it. So how would you take care of that?
Yes, I will check the patient amount of steroid given and the duration is using steroid. And if needed, I will do steroid replacement therapy by giving 100 milligram of cortisol during the surgery.
IV.
And start
Yes.
IVS. And
Yes.
after the surgery, we start infusion of 200 milligram of IV hydrocortisone. And as this is a major surgery, after the patient start taking orally, I will give him double the oral dose and monitor his condition until he returns to the oral dose. Yes.
All right. And after procedure, you'll be monitoring her vitals and you'll be post-operatively taking care of her chest care. Okay.
Yes.
When was the last time chest X-ray was done and what does it show?
Well, I'm sorry, I do not have this information at the moment, but I should check with this after I get off the phone with you.
All right. Okay. So post-operatively or before that,
yes.
After you are done with the phone call, make sure you repeat the chest X-ray.
Okay.
And you said abdominal ultrasound shows free fluid in abdomen, right?
Yes.
All right. Okay. All right. Transfer the patient. Thank you.
Okay. Thank you. Thank you.
Have I missed any other question? Patient might need ventilator. That's the reason why you want to transfer the patient. Good.
Patient might need.
Okay. Yes.